Thanks very much for that, Dr. Simmons. Um, the kind of research that you presented showing the importance of social determinants of health provides the foundation for the work that I'll be presenting today. Building on that foundation, I'll be talking about ways to strengthen families using family-based interventions to reduce behavioral and physical health problems. Before I do that, I do just want to quickly say thank you to the outstanding research leadership team we have at UGA, to my students, to the external funders of the research that I'll be presenting, and the collaborators that I've had over the years at UGA. I've met just so many outstanding researchers here who've enriched my research and my life in lots of different ways. So I wanted to say thank you to them as well. Many of them I've met through the Institute for Behavioral Research. When I got to UGA, I was already very interested in marital relationships and strengthening marital relationships as a way of combating episodes of depression. I was working in a clinical context, so I was working with depressed individuals who had marital problems to show that we could substantially improve those marital relationships, and that improving their marital relationships had an effect on their depressive symptoms, a substantial effect. And I continued that line of research after I got to UGA, but my research also expanded in other directions, thanks to influences and opportunities that emerged at UGA. In particular, I became more prevention oriented. I started wondering whether we could do more than simply react to problems that had already developed, and instead help strengthen families to head off those problems before they developed. And I also became more interested in health disparities, wondering about how we could help families living in more challenging circumstances, who for the most part had not been involved previously in prevention efforts. So here's where we conduct our research at the Center for Family Research. And you can see we are heavily engaged in communities in rural areas of the state, with partnerships in those communities across the state. And that allows us to focus our prevention efforts on those who have been underrepresented in previous research on prevention. I also want to acknowledge that community-based family prevention research is inherently a team effort. It would not be possible without the support provided by CFR staff. And so here are some of the heroes of our research efforts at CFR, and I want to say thank you to all of them as well. The research program over the past 20 years at the Center for Family Research has resulted in a suite of 5 different interventions designed to promote strong families in developmentally appropriate ways. And you can see more about them at our website, which is at cfruga.edu. However, today, I'll just be talking about the Protecting Strong African American Families program, and providing some recent results from that program. The program was developed by our program development team at CFR to meet needs of African American couples raising pre-adolescent and adolescent youth here in the rural South. It has 6 sessions. It's delivered in families' homes. It's expected to have direct beneficial effects in promoting positive family interactions and strengthening several facets of protective family processes. To generate the data that I'll be talking about, we recruited 360 families. We randomly assigned them to participate in ProSAAF or a control condition. And then we collected 4 waves of data over a 2-year time frame. The study was designed to test 4 different types of effects that are important in understanding the potential beneficial effects of family-focused intervention. First, of course, we were interested in seeing whether or not we could have direct beneficial effects on those facets of couple relationships that we were targeting. Second, we wanted to see whether we would find expected ripple effects, or what we call indirect effects, on parents in areas like health and mental health and sleep. And these are benefits that should follow from improvements in relationships and begin to address health disparities downstream. Third, we wanted to see if there were beneficial ripple effects for youth outcomes. And fourth, we wanted to see if ProSAAF could reduce the erosive impact of financial strain and other chronic stressors of the sort that Dr. Simmons was talking about, reducing their connections to problems for parents and youth. And by reducing it, that's really what we mean by building family resilience. So we wanted to see if ProSAAF could be a program that would have an effect on enhanced family resilience. So the first question we wanted to address was whether ProSAAF could strengthen key facets of positive interaction in families, including satisfaction, communication, co-parenting, relationship confidence, spousal support, and protective parenting. And these are those 6 facets. As you can see here, and I'll walk you through this a little more slowly, but as you can see here, in all cases, there are significant effects of the program on these different facets. There's 2 sets of findings here that show you that the effects are parallel for husbands and wives. And what you can see is that in the ProSAAF condition, families are protected against the erosive effects over time. In the control condition, however, we see the expected erosive effects on protective family processes that emerge over time in these difficult settings. And you'll see that the patterns are very similar across all of the variables that we were looking at. So that set the stage for us to examine indirect effects and whether or not there would be ripple effects for mental and physical health outcomes and other beneficial changes for parents. So we found, as we already showed, we found the significant effect of ProSAAF on couple functioning. And then we went on to see these positive beneficial ripple effects on depressive symptoms, on sleep problems, on self-reported health. In these different domains, ProSAAF was having the expected beneficial ripple effects for the parents. What about kids? What about the youth? We also found significant beneficial ripple effects or indirect effects for youth outcomes, including enhancement of youth behavior and choice of peers, less early initiation of substance use, and improved positive self-control. So in each case, there was a beneficial effect that we were anticipating, which led us to then wonder whether or not we might be able to see those expected effects on resilience. Our first resilience question was whether or not we might see a reduction in the negative erosive effect of financial hardship on the couple relationship itself. And as you can see here, the impact of financial hardship elevated financial hardship was eliminated by participation in ProSAAF. So the ProSAAF program is shielding participants from what we would normally see, what we see in the control condition, where elevated financial hardship tends to reduce those protective processes over time. We also wanted to see if we would find a similar effect for protective parenting processes. And again, what we see is that ProSAAF eliminated the erosive effects of financial strain on protective parenting. And we didn't see the characteristic erosion over time from financial strain that we would see without ProSAAF. So given the success of ProSAAF in creating resilience to financial strain, we wondered whether ProSAAF might also buffer the impact of other stressors that put youth at risk, like neighborhood disadvantage or discrimination. So against neighborhood disadvantage, we saw that the answer was yes, and I'll walk you through this. Being in ProSAAF was associated with changes in parent communication and reduced arguing in front of kids, and that reduced the impact of neighborhood disadvantage on change in youth problem behaviors. So ProSAAF was buffering that effect on youth and increasing family resilience. We also found an effect of ProSAAF participation on buffering from racial discrimination. Assignment to ProSAAF increased protective parenting, as we talked about before, and that reduced the impact of racial discrimination experiences on youth depressive symptoms. So, to summarize, we found that ProSAAF had direct effects on several different facets of couple and family functioning that we believe should be important in protecting families. We found the expected ripple effects on a number of adult and youth outcomes. And we also found that ProSAAF was able to buffer effects, indicating increased family resilience. And all these results have been published over the past several years and have prompted us to want to follow up this sample to see what's happening subsequent to this intervention over a longer period of time. And so we are currently collecting more data on adults functioning. We're also looking at effects on biomarkers of health and effects on stress, effects of stress over time. So some of you are probably wondering whether or not we have cool data like Dr. Simmons. Now we do. And so to preempt the question that I'm sure at least some of you are wondering about, here's a preliminary analysis fresh from recently collected follow-up data from the ProSAAF sample, looking at indirect and resilience effects of ProSAAF on speed of biological aging, using the type of DNA methylation markers of aging described by Dr. Simmons earlier. And as you can see here, ProSAAF had the expected effect on relationship communication, and that resulted in an indirect effect on biological aging. That improved relationship functioning is also buffering the effect of financial stress on elevated biological aging. So it's in improving these biomarkers of health as well. And that is a very quick walk through one line of ongoing research at the Center for Family Research. We have many more interesting results coming soon, including examining effects of family relationships on resilience to the stressors associated with the ongoing pandemic. So if you're interested, again, you can see us at our website. If you're interested in more methodological details or more background, the primary references for the material that I presented today are available on this slide. And so you can look this up later on.